Wow, I just got done talking to somebody about suicide awareness, and I have to be totally honest with you. Those were four questions that I truly have never had to ask somebody. I think we kind of beat around the bush sometimes, and we kind of ask, how someone's feeling, or if they're stressed or if they're feeling overwhelmed. But when you actually go ahead and put into terms and actually say, you know, are you having thoughts of harming yourself or are you having thoughts of harming someone else? It definitely puts a different perspective in your mind, and it's definitely difficult because you have to have trust in that person to be honest with you. And I can imagine that even somebody asking the questions to be on the other side and to have trust in that clinician to tell the truth, that's got to be really, really difficult. um, when I went through my role play and I asked Ashley um, to kind of role play having been in the military before, she was really able to give me an insight of kind of the stress that goes into being active duty military, with the idea of deployments and being gone and being away from your family, and the hierarchy in the chain of command. Um, Usually petty officers have sometimes chiefs that kind of ride them, quote unquote, that have them do, pity things, but because they have higher authority, they can kind of get away with that. And having never been in the military, it's hard for me to understand because luckily I've been had amazing mentors that never mandated me to do something based on hierarchy. I think kind of my conversation with her, there was a lot of frustration, and I think there were no immediate red flags for me to see if she would actually harm the person that she was talking about. But it was definitely something that I knew I needed to discuss further with either another healthcare provider, um, and certainly not her chain of command, but maybe her primary care, or I was going to go ahead and put quote unquote a consultant so that she can talk to a healthcare provider, maybe like a psychologist or a psychiatrist. I think it was important to ask her. I explained to her that she didn't really show any immediate red flags, where I think it was a lot more frustration of things that she was saying. But when I specifically asked her how she would do it or what she was thinking to do it, there wasn't a specific answer. And that could be a little bit of trust, but again, within that, I could kind of felt more frustration and not anger that would result in a harmful act. I think it was important to discuss with her that I was going to be talking to a healthcare, putting in a consult for a healthcare psychologist. And she agreed to that, which I think was very important. If she had not agreed to it, I think maybe my conversation would have went a little differently with her. Because in that moment, then she's denying a request that I think could be very, very beneficial to her. It was also really important that I give her my contact information so that if she was having these thoughts again, that she knew that she could reach out to somebody, and if she didn't, she could have a handout of either suicide awareness or the hotline number to call if she became super stressed and wanted to harm someone. I think, like I said, kind of recommending the different actions definitely. Sometimes I think I will always err on the side of caution because we're talking about a life or death situation. So I felt confident though with this decision because, again, she wasn't showing any immediate red signs. Like, she wasn't storming out and wanting to chase him down, or wanting to harm me, or really thought about like harming herself. And when she did talk about harming herself because she didn't want to go on deployment, I specifically asked her how, and her answer was kind of gray. So I think that she's had thoughts of it before, but nothing to the extent of knowing how to follow through with something. So I think it's important that I continue to follow up with her care, and empathetically listen to how she's feeling, and make her understand that feelings are completely okay. You're able to have whatever feeling that arises, but what really depends is how you react to that feeling, the action that occurs after. And so at this time, I didn't feel like there was any action that would be detrimental to her life or someone else's life, but there was definitely a response that made sure that I contact a healthcare provider to get her the help that she needs.